My name is Iris Zink. I am a rheumatology nurse practitioner. I've been in rheumatology for 25 years. I work at a clinic in East Lansing, Michigan, where my husband and I own the clinic. It's a Medicaid clinic serving the underserved. Today, we're going to talk about TYK2 signaling in the STAT signaling pathway and the rationale for TYK2 directed therapy for the treatment of psoriatic arthritis and psoriasis. Tyrosine kinase 2 inhibitors are members of the Janus kinase family. There's JAK1, JAK2, JAK3, and TYK2. All protein kinases have an active domain similar across all kinases in a family and a regulatory domain, structurally different across all kinases in a family. While TYK2 and JAK1, 2, and 3 are all part of the same JAK family, they are unique in structure and function, just like members of your family or my family, where some are better at some things and not at others. Previously, when we studied the pathogenesis of psoriatic arthritis, we talked about TNF inhibition. TNF inhibitors are shaped differently. There's the FC region, and then there's two Fab arms that go through the bloodstream to pull down inflammation. TYK2 inhibitors work differently and are shaped differently than TNF inhibitors. There's a cell surface receptor that accepts interleukin 12, interleukin 23, and type 1 interferon. Then the cell surface, so there's these two cell receptor arms. Then there is the body, there's the cell surface, and below the cell surface are the two legs. And the bottom of the legs, there are these dimers. So the dimers are pairs, like shoes. I have a degree in fashion merchandising, so I use fashion to kind of describe things sometimes. These are a Katy Perry pair of shoes. One has an O, so it's a TYK2 inhibitor, and one has an X, so it could be JAK1 or JAK2. Together, they make a pair, but they work differently. So upon cytokine receptor binding, phosphorylation occurs. The signal is relayed to the nucleus, affecting downstream signaling. Binding of the cytokines to its receptor leads to activation and phosphorylation of TYK2 or JAK enzyme. These phosphorylated TYK2 JAK combination lead to the binding and phosphorylation of the STAT protein. The activated STAT migrates to the nucleus and regulates gene transcription. Interleukin 12 and 23 activate immune cells that drive inflammatory processes in both psoriatic arthritis and psoriasis. Type 1 interferon promotes overactive immune response and are key cytokines responsible for B cell and T cell differentiation, as well as antibody production. When we discuss cytokines, I always think of my 6 daughters. They're pro-inflammatory hormones that are constantly in communication with each other. My daughters are always on the Facebook, the Snapchat, TikTok, Instagram, texting each other to bring each other into the drama of their stories. That's what a cytokine does. It's a hormone-like protein that's constantly in communication with other hormone-like proteins to create inflammation or drama in the human body or in a cell. So when we talk about this cyclic cytokine production, think about the drama and inflammation affecting myeloid dendritic cells to release interleukins that activate T cells, which drive inflammation and proliferation of keratinocytes. So keratinocytes are skin cells that hyperproliferate or stack on top of each other. Normally, we turn over our skin in 30 days, but individuals with psoriasis turn over their skin in about 7 days, creating these giant stacked plaques because of this hyperproliferation of the keratinocytes. Why is interleukin 23 important? Well, it has been shown that individuals with high levels of interleukin 23 have worsening and more severe disease activity. Lastly, let's talk about osteoclasts and osteoblasts. We learned about osteoclasts and osteoblasts when we studied the process or the pathogenesis of osteoporosis. But did you know that cytokine proliferation also leads to pathological bone deposition versus osteoblastic activity? In spondyloarthropathy, this is what is thought to be responsible for the syndesmophyte formation as well as the bridging. Pathological osteoclastic activity causes bony erosions that we're all familiar with. So what makes a TYK2 special? TYK2 only mediates interleukin 12, interleukin 23, and type 1 interferon. Deucravacitinib has a unique mechanism of action that allosterically inhibits the enzyme by targeting the regulatory domain of TYK2. Conversely, JAK inhibitors target the active domain of the kinase, which is similar across a family, which creates a potential for off-target effects, such as effects to blood cell development, metabolic activity, and lipid metabolism. To summarize, TYK2 is like a switch in the immune system that can get stuck on in autoimmune disease. By targeting TYK2, Deucravacitinib doesn't fully shut down the TYK2 pathway, but more so just dials it back. These newly developed therapies can turn down the overactive immune response, providing relief of the inflammatory symptoms of psoriatic arthritis, such as dactylitis, enthesitis, joint pain, and the hyperproliferation of keratinocytes, which causes psoriasis. Therefore, they effectively control inflammation without affecting unintended targets or shutting down the immune system entirely. Thank you for listening, and if you want more information, please look at the WRAP website.